Here at Quad AI, Professor Hans-Jørgen reported the long-term impact of oral desensitization treatment for patients with grass allergy.
The main issue is that if you don't have a long-term efficacy, meaning efficacy after stopping treatment, this treatment will not be of any value. So the long-term efficacy is the crucial point.
Right, and how did that compare to injection therapy?
The magnitude of efficacy during treatment is more or less of the same magnitude as with the injection, and also the 1-year results that I have presented for the sublingual after stopping treatment. So until now it seems like sublingual is equivalent to subcutaneous injections.
The key is going to be, you were telling me before, now looking for the 2nd year after you've stopped treatment.
Yeah. The fundamental idea is the disease modifying effect, and if you don't have that with a sublingual, meaning that you have a long-term, many years clinical efficacy after stopping treatment, I don't think that it is a valuable treatment.
But you're going to follow this up and be looking for that result, I guess, a year from now, more or less.
In this particular study, it will only be 2 years without treatment, because patients don't want to be in a study for 5 years is a long time, and it would be nice to have 5 more years, but it's not impossible.
Right. So if you can see results, I mean, so far you would characterize the results as being comparable to what injections can achieve. So if you can continue to see that for another year, what would that mean in terms of using this? Would this be what kind of option for patients?
Yeah, I think that the most important issue would be that this is an alternative to the shots. And I think that patients would have the opportunity to select either the one or the other disease-modifying treatment, in contrast to just having symptomatic that will not treat the disease, but only reduce the symptoms.
Right. Is this going to be an option, you think, that will appeal to at least a significant number of patients when they're given the choice? Or?
I think the problem with allergic patients is that they have accepted just to have reduced the disease, the symptoms reduced, not to try to cure the disease. And I mean, in any other disease, if you have a sore throat due to bacteria, you will have penicillin, that means curing the disease. But in allergy, you just reduce the symptoms, don't cure the disease. And I think the optimal would be to try to cure the disease.
Be it with injections or
either injections or the sublingual. That depends on the patient's preference.
Which they prefer. And just one other thing, so if you could very briefly talk about the safety. Were you satisfied with the safety that you've seen over these several years now?
I think that we have seen some local side effect, itching in the mouth, irritation in the throat, but no serious side effects. And that is a contrast to the injections with the risk of anaphylaxis. So there are really some advantages in relation to safety in the sublingual treatment.
So this actually looks like, in some respects, it could be safer than injections?
It is safer, no doubt about that, yes.